All right, class. So this lecture is going to talk about the cranial nerves, which are involved in the movement of the eye, and that includes cranial nerve number three, which is known as oculomotor nerve, cranial nerve number four, which is known as trochlear nerve, and cranial nerve number six, which is known as abducens. So we're going to talk about these three nerves. As I told you in my previous lecture when I was teaching the trigeminal nerve, I told you the key concept that whenever you're covering any cranial nerve, you need to cover these headings, which includes nucleus, the root of that nerve, the emergence. The emergence is basically defined as from where the cranial nerve exits the central nervous system. And then you have the course. The course is further divided into the intracranial course and the extracranial course. You need to know from which foramen this cranial nerve is going to exit the skull and enter another cavity or enter another region of the body. And then you need to know how this nerve is going to terminate. It can terminate by giving the branches mostly, and it can also give branches along its course. And also you need to know the functionality of these nerves. So let's begin with oculomotor nerve, which is the cranial nerve number third. As you know, the name suggests it. The name can be divided into oculo, which basically means eyeball, and motor. Basically, this is motor nerve. So it contains motor fibers as well as other fibers, which we'll just talk about now. So when we talk about the nucleus of the oculomotor nerves, so you can clearly see this diagram. This is the diagram that talks about, which is it's showing the cut section of the midbrain, which is at the level of the superior colliculus. And here you can clearly see that this is the main motor nucleus of the oculomotor nerve. So with this, the main motor nucleus of the oculomotor nerve is present at the level of brainstem, specifically midbrain, at the level of superior colliculus. So you can clearly see that the nerve arises from this nucleus right here all the way. So this would be the motor fiber which is running in the oculomotor nerve. Furthermore, if you talk about the connection of these nuclei, so you can clearly see three major connections. One connection is shown through yellow line, which is basically connecting the main motor nucleus to the cerebral cortex. And then this shown through blue line, which is coming from the superior colliculus. The fiber basically runs in the these fibers are known as the tectobulbar fibers, and they basically connect the superior colliculus to the main motor nucleus of the oculomotor nerve. And then you have medial longitudinal fasciculus, which is also connected to the main motor nucleus of the oculomotor nerve. Further going, there is another nucleus which is present right next to, a little bit posterior to, the main motor nucleus of the oculomotor nerve. And this nucleus is basically known as the parasympathetic nucleus of the oculomotor nerve, also known as the Edinger-Westphal nucleus. So Edinger-Westphal nucleus is also present in the same location at the level of the superior colliculus. However, this is present posterior to the main motor nucleus. So this nucleus is basically responsible. This is connected to the pretectal nucleus, which is present right here along, and you can clearly see these are the two fibers which one crosses over and remains on the same side. And the fiber that are arising from the Edinger-Westphal nucleus, these are the parasympathetic fibers shown through this brown dotted line. And this basically runs within the oculomotor nerve. So basically in oculomotor nerve, there are two types of fibers. One is the motor fiber, which originates from the main motor nucleus, and another one is are the parasympathetic fibers which arise from the parasympathetic nucleus of the oculomotor, also known as Edinger-Westphal nucleus. Now, when we talk about the root, obviously we have two roots. One is the parasympathetic root, another one is the motor root, but both are running within the same nerve. And as you all know, the emergence of the oculomotor nerve emerges from the midbrain and from the interpedunculaire fossa on the anterior aspect of the midbrain. We talk about the course. As soon as it emerges from the central nervous system, it basically runs anteriorly, and it runs between the posterior cerebral and superior cerebellar arteries, and then eventually it enters into the lateral wall of the cavernous sinus, which we have covered in our previous lecture, that on the lateral, from the lateral wall of the cavernous sinus, there are four nerves that passes through. One of them is oculomotor nerve. Then the point where it exits the cranial cavity to enter the orbital cavity, It basically passes from the superior orbital fissure, and the moment basically it enters into the cavernous sinus, it divides into its superior and inferior rami. Here you can clearly see the moment this is where the cavernous sinus is present. Oculomotor enters with the lateral wall, the cavernous sinus divides into the superior and inferior branches of the rami, and finally these two things, they run from the medial aspect of the superior orbital fissure to enter the orbital cavity and supplying the extraocular muscles, which you have already covered in previous lecture. So it terminates by supplying the extraocular muscles, including levator palpebrae superioris, superior inferior medial recti, and inferior oblique muscle. And the parasympathetic fibers coming from the Edinger Vespa nucleus, they are responsible to supply the intraocular muscles, which are known as CDD muscles and constrictor pupillae. As far as its functionality is concerned, so this oculomotor nerve is responsible to move the eyeball, and it is responsible for two reflexes known as the accommodation reflex and pupillary light reflex. Next, when we talk about now we talk about the trochlear nerve, which is the cranial nerve number fourth. Now, cranial nerve number fourth is also exclusively a motor nerve, which is going to move the eyeball by supplying one muscle, which we'll talk about later. Now, when we talk about the nucleus of the trochlear nerve, it is present exactly at the level of the midbrain again, but at the level of inferior colliculus. So you can clearly see the nucleus of the trochlear nerve right here. That's the motor nucleus of the trochlear nerve present at the level of inferior colliculus of midbrain. Now, these are the similar connections to the trochlear nucleus. One fibers are coming from cerebral cortex, and another fiber known as the tectobulbar fibers are also coming from the superior colliculus as well as they come from the inferior colliculus. And then you have medial longitudinal fasciculus connected to the trochlear nerve nucleus. The root, again, it only has it only has one root, which is the motor root. You can clearly see it, and it emerges. It's the only nerve that emerges from the posterior aspect of the midbrain, and it is also the only nerve that crosses over. As you can clearly see it here, that the nerve, all the way the moment it emerges, it crosses to the other side, like this. So this is important that trochlear nerve is the only nerve that crosses over, and trochlear nerve is the only cranial nerve that uh, emerges from the posterior aspect of the brainstem. Now, when we talk about the course, it follows similar course as oculomotor nerve. It decussates immediately after emergence. Then it runs over the superior cerebellar peduncle. Then it runs between the superior cerebral and superior cerebellar arteries, and then finally it enters the lateral wall of the cavernous sinus. The moment it exits the lateral wall, it passes from the superior orbital fissure to enter the orbital cavity. Now it supplies the one muscle which is known as the superior oblique muscle, and that muscle is basically responsible to move the eyeball downwards and laterally. Lastly, we're going to talk about the abducens nerve, which is the sixth cranial nerve. This is also a nerve which is responsible to move the eyeball, and this is also exclusively a motor nerve. When we talk about the nucleus of the abducens nerve, you must know about the facial colliculus, which we have covered in when we were teaching you brainstem, or more specifically pons. So at the level of pons, this diagram shows the section of pons, and facial colliculus was that time it was defined as it's a globular swelling on the posterior aspect of the pons due to the underlying facial nerve winding around the abducens nucleus. So abducens nucleus is present basically underneath the facial colliculus at the level of pons. It is also again connected to the cerebral cortex, medial longitudinal fasciculus, and tectobulbar fibers from the superior colliculus, so that these three nerves can easily function along with coordinating with each other, so that your eyeball have a very coordinated movements. Furthermore, you know the root, it only has one root since it has only one nucleus. The emergence of the abducens nerve is at the level of pontomedullary junction. It is the medial most nerve which emerges from the pontomedullary junction along with facial nerve and vestibulocochlear nerve. Then again, it follows a similar route. It basically enters. The only difference is that the moment it exits the CNS, it enters into the medial aspect or the cavernous sinus cavity. And the moment it exits the cavernous sinus cavity, it enters the superior orbital fissure and enters the orbital cavity and supplies one muscle that is known as the lateral rectus, as the name suggests, is responsible to move the eyeball laterally. So this was all about the three great nerves responsible to move the eyeball. That's oculomotor, trochlear, and abducent nerve. And if you have any question, please feel free to ask.